Hello, my name is Dr. Paul Rinaldi. I'm a clinical psychologist and an addiction specialist. I am the director of the Addiction Institute of New York, which is the division of substance abuse treatment at St. Luke's and Roosevelt hospitals, which are members of the Mount Sinai Health Network in New York City. I've been in the addiction field since 1990. Since that time, I've seen a rapid progression of science and technology, which has developed medications and behavioral treatments for addictive disorders. I remain passionate in my work because I've had the privilege over the years of working with many people who have gone from being homeless, having mental illness, having no family or other social supports, into being productive members of society who have dignity and full, wonderful lives. Again, I say that's a privilege because people let me into their lives and allow me to work with them over the course of sometimes years and work with them to help them achieve their goals. Sometimes they start out not even having goals, and we develop goals together and we work towards achieving them. And that's a great honor, it's a great privilege, and it's something that I intend to continue to dedicate my career to. If you'd like to learn more about me and the services provided at the Addiction Institute of New York, please visit www.addictioninstitutenewyork.org. I hope the viewers of this Howcast series on alcohol can feel empowered to help themselves or help their loved ones take action to get the help that they need and that they deserve. People are often curious about if there are myths about alcoholism, and there are. One myth is that alcoholics are drunks forever, and they can never, once an alcoholic, always an alcoholic. And that may be true, but that doesn't mean that people are drunk forever. People stop, people are very successful with different ways of treating their alcohol problems. A second myth is that alcohol problems are a moral failure, and that all that's needed is willpower. Therefore, that lack of willpower is what causes the problems. Well, in fact, that's not true. Alcohol problems are generally caused by a genetic predisposition and physical changes, and therefore physical dependence on alcohol that develops. A final myth is that people with alcohol problems are all people who are down and out, who are drunks on the street, whose lives and physical beings are in tatters. That's a myth. In fact, people with alcohol problems come in all stripes. Men, women, young and old, people who hold down jobs, people who appear successful but have alcohol problems. So those are three common myths that are associated with problematic alcohol use. People are often curious about what kinds of treatment there is for alcohol problems. When people are most interested in alcohol rehab, when people think of alcohol rehabilitation facilities, they usually are referring to inpatient rehab facilities. The standard alcoholism rehabs are what's called 28-day facilities, and they are 1-month treatments. In those treatments, there's many alcohol rehab treatment centers across the United States. Most of them provide very similar treatments to each other, and that usually consists of very intensive days. Usually people are housed in, sometimes it's private rooms, sometimes it's not. Some treatment centers allow people to have phones or computers. Many do not allow that because they really want people to focus solely on their treatment and what they're doing there. So what alcohol inpatient rehab does is it immerses people in treatment for alcohol. They live and breathe the treatment 24 hours a day. Usually that treatment consists of a variety of group therapy sessions each day, often an individual therapy session each day, and often inpatient rehabs during the course of that month-long stay. Usually during the third week of treatment, they may have families come and have a few days of intensive work with the families sometimes with the primary patient and sometimes without the patient. It's usually a combination of both. So those treatments are usually considered by many the gold standard of substance abuse treatment. As an addiction professional, I don't have that view. I think alcohol inpatient rehab is extremely important for many people, particularly people who have a history of trying to stop and maybe successfully stopping, but then resuming using. Often those people are people who really need that time away. They need that time. The other group of people is people who can never stop, who have never stopped. They really need that protected environment where they know they're going to get a month of clean time, where they stop and they can really focus on themselves during that month. The thing that people have to always be careful of is seeing the 30-day as the be-all and end-all. It's an extremely important step in treatment, but it's just one step. And then people need to be referred to outpatient aftercare treatment. So they have an ongoing treatment where they're looking at their problem and touching it every day. So when most people are asking about rehabilitation, they're asking about 28-day inpatient rehabilitation facilities. And that is generally the standard for inpatient treatment of alcohol issues. When people are drinking heavily, they're often concerned that if they stop drinking, will they have withdrawal symptoms from alcohol? It's not necessarily predictable if they'll have symptoms, and if so, what those symptoms will be and what the severity will be. However, alcohol withdrawal can be very serious and potentially life-threatening. Alcohol withdrawal symptoms can start within 5 to 10 hours after stopping drinking, but can also not start for up to 48 hours after stopping. So just because you don't experience any symptoms right away, that doesn't mean you won't have them. A lot of it depends on the person's constitution, their metabolism, and of course the amount of alcohol they've been consuming. So alcohol withdrawal symptoms can range from mild tremor, just shaking, feeling shaky, and literally their hands shaking. But also that can progress, and people can also have, along with that, they can feel a lot of anxiety, which is they often don't think of as a withdrawal symptom, but actually is. But the more severe alcohol withdrawal symptoms can be actual seizures from the withdrawal of alcohol, that the brain reacts and people will have seizures. Seizures can be very life-threatening. Even mild seizures can be dangerous because one doesn't know when they're going to come on. They come on very quickly, often within just seconds, where people may have a slightly weird feeling and suddenly seize. And when one seizes, one is not really conscious, and you fall. So that can be very dangerous because people can be driving, they can be walking on the street, they can be in situations where a seizure can cause other kinds of dangerous situations. If someone's driving and has a seizure, they can get into an accident, they could hurt themselves, they could hurt other people. And also seizures in and of themselves can be life-threatening. The other more severe withdrawal symptom is called DTs, delirium tremens. The rate of death from DTs is actually very, very high, but DTs fortunately are quite uncommon. Seizures are much more common. So when people are going to stop drinking, if they've been drinking heavily, I highly recommend that they do so under the care of a physician, that they consult a physician, they speak to the physician and have someone evaluate how much they've been drinking. And what they often require is a medication taper, where they're given a medication that will help them avoid those withdrawal symptoms, that's tapered down from in the dose over a few days until they're off that medication. And then they can be guaranteed that they're not going to have serious withdrawal symptoms. So that is what to look for and what to be careful for when stopping alcohol. We often are asked by people what kinds of treatments are available for alcohol problems. The standard treatments are either in rehab facilities or 12-step, meaning Alcoholics Anonymous or Narcotics Anonymous for people who use other drugs. Alcoholics Anonymous is widely known, but people often want to know what else can they do? What are alternative treatments to the standard kinds of either hospital-based rehabs or 12-step Alcoholics Anonymous meetings? The one thing I always tell people is that there's not one way to get clean from alcohol and to stay clean from alcohol. So for some people, they want to pursue alternative treatments. Well, I have to caution people that we don't have any very good evidence in research that support the alternative treatments as standalone treatments. So what I usually refer to alternative treatments as, I refer to them as adjunctive treatments, that they're often added on to other kinds of treatment for people. And those might include hypnotherapy, they might include yoga or other kind of mindfulness exercises, meaning meditation. People really sometimes find that very, very helpful. But there are people who do those kinds of things who really do meditation well, for an example, and other people who just don't meditate well. So you have to look at different kinds of things. There are treatment facilities that use what's called equine therapy. They use horses therapeutically. And people will talk to, there's not, again, a good research base that shows that those have positive effects. But anecdotally, from people's experiences, people find those things very powerful. And so as a treatment provider and as a researcher, although there's not an evidence base, I always tell people to try different things and to use what works for them. So there are many alternative treatments. Again, my recommendation is that people see those as, rather than alternative, as adjunctive treatment to more standard treatments that we do know work from research.